You've probably heard about the potential health perks of getting enough vitamin D, but what does the science actually say about its measurable benefits? Vitamin D has long been recognized for supporting bone density by promoting calcium absorption. But newer areas of research are investigating its effects on chronic diseases and even brain health. I'm going to walk through what the latest medical reviews tell us. Starting with the brain, vitamin D receptors are scattered throughout the brain in areas like the hippocampus that control planning, memory, and learning. Some studies reveal connections between low D levels and poorer cognitive test performance, especially among at-risk elderly groups. However, while supplementation trials have seen some benefits to memory and executive function, results remain inconsistent across studies. Emerging evidence also suggests vitamin D may impact development of neurodegenerative disorders, those afflicting memory and movement, like Alzheimer's and Parkinson's diseases. While promising links exist, hinting vitamin D may reduce accumulation of Alzheimer's brain plaques, we lack robust causal data at this point. Cognition. Improved cognitive performance in healthy adults over 50 years old. Possible reduced rate of cognitive decline in adults over 65 years. Mood. Reduction in depressive symptoms when combined with antidepressant therapy. Improved well-being and mood in healthy young adults. Immunity. Enhanced macrophage activity against bacteria. Increased anti-inflammatory cytokine production. When it comes to vitamin D for extending lifespan and protecting against major illness, again we have conflicting findings. Observational data does associate low vitamin D levels with higher rates of various chronic diseases. Yet direct interventional studies supplementing with vitamin D have failed to clearly reduce risk or mortality for conditions like heart disease, diabetes, and even cancer. Here are some key medical studies that have been conducted on mice models to investigate the potential health benefits of vitamin D supplementation. Cancer studies. Vitamin D supplementation reduced tumor growth, metastasis, and cancer-related mortality in mice injected with breast, lung, and colon cancer cells. Mice fed vitamin D had less inflammation and inhibition of premalignant colon lesions compared to controls. Autoimmune disease. In mouse models of multiple sclerosis, vitamin D supplementation prevented the development of paralysis and reduced nerve inflammation and damage. Vitamin D lessens severity of inflammatory bowel disease in mice by regulating production of protective microbial compounds. Diabetes. Islet cells in diabetic mice produced more insulin when supplemented with vitamin D compared to placebos. Vitamin D may suppress inflammation, contributing to insulin resistance and pancreatic cell death. These preclinical mouse experiments help establish biological mechanisms supporting vitamin D's potential therapeutic roles in various diseases. However, findings still need validation in human randomized controlled trials. When it comes to getting enough vitamin D, you can either turn to supplementation or sunlight. Recent analyses suggest that getting 10 to 30 minutes of midday sun exposure about 2 times per week is often adequate to reach healthy blood vitamin D levels in most people. However, reaching optimal levels can require more significant sun exposure, which can increase skin cancer risk. If supplementing, vitamin D3 has been shown to be the most effective form compared to vitamin D2. D3 stays active in the body for longer and more efficiently raises blood levels. Most experts recommend a daily vitamin D3 intake of 600 to 800 IU for adults generally, but those who are deficient may require higher supervised doses around 1,500 to 2,000 IU to restore their levels. Vitamin D does more than just help build strong bones. Research shows it plays a role in many body processes like cell growth, immune system function, and more. Some studies have linked low vitamin D levels to higher risks of various health problems. Everything from skin conditions to heart disease to cancer. However, results from clinical trials testing vitamin D supplements have not shown benefits as clearly. There are a few possible reasons why. The clinical trials may have had too few participants or did not measure other factors that could affect results. There are also questions about whether vitamin D directly causes health issues or if low levels just happen alongside them. More research is still needed, especially large, well-designed studies, to know if vitamin D definitely impacts diseases outside the bones, and if vitamin D supplements can help treat complex health disorders. Overall, the evidence is still unclear if vitamin D levels directly lead to other health issues or are just associated with them. More research and bigger studies in the future may help explain if vitamin D has a direct causal effect on human health and disease outside of bone health. So in summary, the vitamin D health story remains complex. While optimal vitamin D does seem tied to neurological and musculoskeletal functioning, more research is still needed to elucidate its roles in specific diseases and longevity. Stay tuned for more updates as future studies emerge. Thanks for sticking to the end. Please smash that like button and subscribe for more helpful content and health and wellness. See you in the next video.